Hey, what's going on, everyone? Thank you for tuning in to another episode of the Off the Battlefield podcast presented by Veterans Claim Servants. Today, I'm with Dr. Prashant Sharma. He is a Air Force veteran and a board-certified psychiatrist, and very familiar and specializes in nexus letters and disability benefits questionnaires. How are you doing, Dr. Sharma?
Not bad, Blake. Thanks for having me on. How are you doing?
Hey, I'm doing awesome. I'm glad to be with you, man. Anytime to hang out with you and talk a little VA stuff and any education to get out there for veterans is a good day. If you are tuning in, make sure you like, subscribe, comment, hit that notification bell, share this out with a fellow vet or transitioning service member that can use this help. We hope that you get a lot out of this episode today. So today we're going to be talking about a couple of things. Chronic fatigue syndrome is something a lot of people don't know about, but it's a pretty popular secondary condition to like PTSD and stuff. And we're going to talk about some of the changes and Dr. Prashant will that the VA is kind of looking for just to, help you out, blood work and things like that, and some of the documentation recommended. We'll talk about any changes that we see taking place in mental health claims and stuff like that, and any updates on the DBQs. Dr. Prashant and I are going to be talking about that today. So we hope you get something out of this. And Dr. Prashant, thank you, man, again for being on here. I want to get into the chronic fatigue syndrome and talk about that first topic. If you don't mind talking about chronic fatigue and kind of what it is a little bit, that would be great.
Absolutely, yeah. It's a great question and a great topic. So chronic fatigue syndrome, right? And there's a lot of symptoms that go along with this. It's not only debilitating fatigue, but it's a lot of symptoms that come from what we think of when we get a flu, right? And we have like flu-like symptoms like joint aches, muscle weakness, headaches, brain fog, slower thinking, forgetfulness. And there's a couple of more symptoms on there, like sore throat that keeps coming back, lymph nodes that get swollen. These are all those symptoms that we get when we get a virus. But with chronic fatigue syndrome, these symptoms happen even though you're not infected, right? You don't have an infection. You don't have like the flu. You don't have COVID or anything like that. So that's what it comes from. And what it seems to be is more of like an autoimmune disorder, right? So it's like the immune system is attacking the body itself, okay, because of something that triggered it to happen. And there's a lot of triggers for it, right? And one of the triggers is deployment, right? So deployment to the Middle East, right? The Persian Gulf. And that happens to be a presumptive, actually, even though it can be really difficult to get it approved as a presumptive at the VA level for some reason. But it is a presumptive if you were deployed to these locations in the Middle East and the Persian Gulf. And if you're diagnosed with chronic fatigue syndrome, then you can get it connected because the theory is that it's due to these exposures that happen over there, and it activates the autoimmune system, and basically the body attacks itself, right?
Sure. Yeah. Absolutely. Remember to veterans, if you are filing anything secondary, it's very, very important. You can't just say, I was talking with a veteran today and he was saying, hey, I've got this because of my migraines, right? I've got this symptom because of my migraines. Well, remember, you need a disability benefits questionnaire, right? You need a nexus letter and you need a diagnosis if you're going to secondary anything. And I recommend having absolutely an up-to-date diagnosis and up-to-date treatment records if you're going to file for chronic fatigue, even if you were in a presumptive area. Wouldn't you agree with that, Doc?
Oh, 100%. Yeah. No matter what, whether it's presumptive or not, you got to have that medical evidence, the medical records. And so that brings us to the main point of this, right? So with chronic fatigue syndrome, what we've noticed, and I think both you and I have noticed this, is one piece that's missing that the VA is looking for is blood work. Okay. So chronic fatigue syndrome is something called a diagnosis of exclusion, right? So that means that other conditions that can cause fatigue and those symptoms have to be ruled out first, and then it's chronic fatigue syndrome. So, yeah. So for vets out there watching, you're probably wondering like what blood work? There's so many different tests, right? So, and of course you can ask us this as well, okay? But basically it goes with a complete blood count because you want to rule out there's any anemia there.
Mhm.
A comprehensive metabolic panel, make sure there's no liver disease, kidney disease, anything else that could cause these symptoms.
Sure.
A thyroid panel because hypothyroidism can cause fatigue and these types of symptoms. You want to rule that out. And then for men, you want to try to have testosterone because low testosterone can cause debilitating fatigue at times as well. So those are some of the blood work that I recommend getting done. And you can get this done with your primary care doctor, right? So let's say you go in and you say, hey, doc, listen, I've been fatigued and these are my symptoms and I've had this for this many years. Can you test me for these different things? Can you check? Yeah. Can you check me out and make sure there's nothing else wrong? That's really serious. And so then you can get the blood work that way. And then one last thing also is if you do have sleep apnea, or if you do have like snoring and you gasp for breath overnight, then you do have to get a sleep study done to make sure it's not sleep apnea. Now, that doesn't mean that if you have sleep apnea, you can't have chronic fatigue syndrome. That doesn't mean that. What it means is that we have to first make sure that the obstructive sleep apnea is treated with CPAP. And then if it's treated and if the chronic fatigue syndrome is still there, then it's a separate condition.
Absolutely. So we're just doing a process of elimination, essentially.
That's exactly it. That's the best way to say it. And it's not, it sounds complicated, but it's not too bad once you get through it and get that testing done.
Well, that's everything. Like whenever I talk to a veteran, that's what I explain to them is like, if it's not clear cut and concise, if you don't have an in-service treatment, stressor, diagnosis, and it's not in your C file, your STRs, or your active duty records, then how are you going to prove it? How are you going to establish a nexus? You got to establish it to something, and you can't just say you have it. So the VA is basically saying, even when you get favorable findings, they're saying, hey, Doc Prashant, Blake, prove it to me. Show it to me. You know what I mean? Like, just show me, like we're giving you, and they actually give you clues in rating decision letters. You will get favorable findings. You'll see there's no in-service treatment, stressor, or anything like that. No complaints in your medical records. However, you'll get favorable findings, and it'll say VA examiner diagnosed you with chronic fatigue on date of your C&P examination. But there was no nexus that was established. So you need a link, and hello, that's a clue right there that you have it. Then you need to go back to your rating disability breakdown letter, right? That secret sheet, that secret weapon that the VA doesn't like to give out. And you want to know, okay, do I have something that can be triggering this chronic fatigue? And if you do, then it ain't enough for you just to say, hey, Dr. Prashant, I've got PTSD and I want to connect my chronic fatigue. It needs to be proven, backed by medical and scientific literature. So you need to understand that, veterans. I mean, that is like the pro tip of pro tips right there. We just gave you a golden nugget right there, right? I mean, you got to.
Absolutely. Yeah, I agree completely. And that's what we get into with the evaluation, where we go through and we say, all right, so how is this stuff connected? Exactly like you're saying, all right, well, I noticed that whenever I get nightmares, my sleep is disrupted. That's when my PTSD is acting up. That time of the year comes around where it's the anniversary of something that happened, things like that. And then all of a sudden I'm hit with these flare-ups of chronic fatigue, and it comes with these other symptoms. That's how we start to build the case, and we start to see, oh, wait, these things are connected, And another thing we tend to find out is the veteran will tell me, ever since I started having PTSD symptoms, as the PTSD has been getting worse, so has the fatigue, and then you're like, oh, wait, okay, tell me more, and that's how we build it up pretty much.
Absolutely. And veterans, treatment. You don't stop. Remember, the VA rates on a GHA scale, that's the Global Health Assessment Scale. You aren't getting paid because you had a Purple Heart or anything. You're getting paid because of how you're impacted occupationally and socially. So you have to keep that treatment, and they use the presumption of sound doctrine that if something doesn't happen and there's no complaints and there's nothing in your STRs or your VA medical records, then how can you expect the rater to approve that? How can you expect them to approve that? They just go, okay, doc didn't complain about it, so it's not in here. We're not going to grant it, and that's kind of it's known as the presumption of sound doctrine. So you've got to make sure that you're getting treatment, that you're taking care of yourself, and always just think about it. Always come with as much evidence as possible. It's not going to hurt you. If they don't need it, they won't use it, but you'd rather come with more than less. You'd rather be proactive rather than reactive. So get treatment. I know we as veterans hate talking about stuff. I know we like to suck it up and internalize and do all that stuff, but don't do that, because it just hurts you. It hurts you. And remember, these benefits too and stuff are for you and your family, because your symptoms and everything too, they impact your family and your loved ones as well too, because they live with you.
Absolutely.
And the higher VA rating that you do get, there are more benefits available to you, which you can check state by state. Just Google it, look it up, whatever state you live in. So, but again, you got to get treatment. You got to get taken care of as well. A lot of veterans get denied because they don't continue treatment or they give up. So don't give up, So I want to go to a different topic here. Is there anything else you want to cover on chronic fatigue, Dr. Prashant? I kind of went off there. Just anything else on that?
No, I mean, I think you got it. And, the final point which you made, which is the social and occupational impairment on that, is how is the chronic fatigue? And that's something to think about, right? Veterans can think about this before the evaluation or as they're applying or when they go to the primary care doctor, is how is it stopping me from spending time with my family? How is it stopping me from taking care of my kids? How is it stopping me from doing chores around the house? Maybe because of the chronic fatigue being so debilitating, you can't mow the lawn anymore. So now you got to get a lawn crew or whoever to do it, and you got to spend money on that. How's it affecting the job? Oh, I used to be a lot more physical in the job, but now I have to work from home. You want to think about all those things and how it limits you. That was the last thing I wanted to say.
No, absolutely. And also, I do want to leave you guys with this, and this is specifically regarding CFS. The VA will consider granting the disability rating and award compensation, and they use this following criteria, okay? New onset of debilitating fatigue, severe enough to reduce daily activity to less than 50% of the usual level for at least 6 months, okay? So again, you need to have documentation and treatment, and you need to articulate that, right? Daily activity to less than 50% of the usual level that's normal for you veterans or military members of at least 6 months. And then again, just solidifying your point, Dr. Prashant, history of studies and lab work showing the doctor ruled out other possible conditions that may be causing the same symptoms. 6 or more of the following symptoms are as follows: acute onset of the condition, low-grade fever, non-exudative pharyngitis. I think that's how I say it. Swelling of the back of the throat with no mucus, tender palpable lymph nodes, neck or underarms, generalized muscle aches or weakness, fatigue lasting longer than 24 hours after exercise, headaches, migratory joint pain, neuropsychological symptoms, burning, numbness, tingling sensations, sensitivity, sleep disturbances, etc. And remember, the VA disability ratings for CFS, chronic fatigue, are 10, 20, 40, 60, and 100, depending on the severity of your symptoms. Just know that. So I want to leave us with that too.
Perfect.
Yeah. So let's kind of digress here and let's change some topics here. Any changes that you notice taking place in the mental health claims? We were talking about it in the earlier part of 2024, like, oh, there's potential changes. What do you see progressing with that as far as mental health claims and the DBQs and the criteria?
Yeah. Another really, really interesting one. And this is something that a lot more veterans have been asking me about over time that I've noticed is they're asking me, hey, what's this going on with the new criteria and everything? So basically, there's new proposed criteria, and it's supposed to be coming out in April of 2025 next year.
Yeah.
Who knows, right? if that's going to happen or not. It looks like it likely will, but you just never know. But those rating criteria are not in effect yet. It's going to change. It's going to change significantly, actually. And whereas it's going to be impairment in several domains of life rather than more of a checklist, right? So right now it's kind of a checklist of symptoms, and there's certain symptoms that fit in 30 and 50 and 70 and 100, and nobody really tells you about how many symptoms you need and which one. And, there's various different sources on that, and opinions, and whether or not you have to have suicidal ideation for 70% and everything. So it's unclear, right? So now they want to transition to this domain thing. And it's very interesting. I do think it's evidence-based. The only sort of issue, so overall, I think that veterans will be qualifying for higher ratings based on the proposed new changes. But what worries me is C&P exams, right? So with C&P exams being relatively short, 15, 20 minutes, sometimes shorter, sometimes longer, I worry that they won't be able to capture the true extent of the mental health condition, especially because now with the new criteria, it's going to be more complicated. Like, you have to think about the case more. You have to think about the different domains. It's not a checklist anymore, So that's what I worry about. Not to be pessimistic. I mean, I think it is going to help. I think there are going to be some benefits, but it always makes me take pause when I think about the C&P exams,
Yeah, and the problem with the C&P exams too already is that we have a lack of training and education with the C&P examiners, and I don't mean that people are just like dumb or anything. I just mean that when I say lack of education, very educated, but not specifically in the DBQ, the disability benefits questionnaires, and Nexus. It's and I know a doctor that's a C&P examiner, and he says, yeah, I was just given some video, some training online very briefly, and I'm just filling these things out. And a lot of times people, these doctors are not veterans and stuff, so they're just evaluating, sending, and there's a lot of errors, there's a lot of mistakes. So veterans, if you see why something got deferred, that could be a potential reason, because the rater had to give the DBQ back to whoever did your C&P examination to correct errors in the DBQ. Or it takes 5 or 10 minutes and you're out of there and the right questions aren't asked. Many veterans have went to C&P exams, and these doctors or whatever are brand new. And veterans, if you're wondering why you go to a C&P exam and the doctor's maybe a nurse practitioner or something, and they don't feel qualified, because they are qualified according to the 38 CFR. And again, the VA and QTC, Optum, and Veterans Evaluation Services, they have a very difficult time keeping, finding doctors to fill out these DBQs and Nexus letters across the country. So that's why they've subcontracted out to those 3 companies to try to Optum, QTC, and VES that's their job. So if you have to wait and stuff, it's because they're trying to find a doctor for you to see. Somebody that knows how to fill it out, because the rater can't do it. Remember, the rater is not a doctor. The rater they're looking at 38 CFR as well as I could look at 38 CFR. The doctor's got to diagnose you. The doctors, by law, got to fill out that disability benefits questionnaire, and it's got to be the correct doctor, board certified doctor. So those aren't always easy to find, and you have to have doctors that are willing to want to do it, because most doctors, right, correct me, are focused on a specialty area of practice, and that's what they've been trained to do and got their doctorate in, right?
Exactly. Yeah. And everybody, once they're in that specialty, they focus on that. Just like I focus on psychiatry, mental health, and neurological conditions,
Yeah,
well.
it's like, but like you've just chosen to say, hey, I'm going to do this VA stuff as well too. You could focus on many different areas according to your expertise, but you just say, I am going to focus on the VA stuff. I'm a veteran and I'm going to focus on that, right? But you don't have to. There's other things that you can do too. So veterans, we're very fortunate. Take it easy on the docs, and stuff like that. And but we're very thankful for you. I'm thankful for you, Doc. And without you, a lot of veterans wouldn't get helped. So they need to understand that.
Oh, well, thank you for saying that. And thank you for what you do with veterans and
Mhm.
helping them along this whole process as well.
Yeah, the important thing is to provide the education, to provide the knowledge that they need, to provide them the guidance so that they can be in the best position, honestly and integrally. That's what it's all about. And sending them to people that aren't just, running them through, but that are just like, hey, I'm going to take the time. I'm going to look at it. I'm going to listen to you. I'm going to evaluate you properly and stuff. So, uh, Doc, getting back to those mental health changes, I think that those are areas of concern. The C&P exams, because the C&P exams are already caught. They already cause a lot of issues. There's already enough mistakes. So, do you think that there would be? I know it's hard to gauge this, but do you think that there would be more mistakes?
That's what I'm worried about. You kind of read my mind with that one.
Okay.
Is I'm worried because right now what I see is a significant trend. And again, I'm not saying all CMP examiners, okay? So
No.
because there are certainly really qualified ones who do thorough exams. But what the trend I'm seeing is that folks are being underrated based on these C&P exams that are very quick. And, I kid you not, I'll see a C&P exam where only 2 or 3 check boxes are checked, right? But when you read the veterans' records, you can clearly see that they've been going to the VA and they've been talking about like 18 symptoms, right? That you can see that should be checkmarked. And you can also ask the veteran the questions and they'll tell you that they are experiencing those symptoms. So basically, it's underrated, right? A lot of folks are being underrated based on just a few check boxes being checked on these DBQs.
Mhm.
So, in that same breath, I worry about that same problem being applied to the new guidelines where, you have to sit down with the new guidelines, you have to sit down and you have to take all the symptoms, you got to do a full evaluation, and then you have to think, okay, let's look at each domain and what is the severity of impairment in each domain? What's the level, right? And you have to think about it and then you have to grade it and then you have to add it up and then you have to come to a conclusion, right? And I'm worried that a lot of the CMP examiners might not do that fully, or more underrating might happen, based
Mhm.
on that, if that makes sense.
No, it totally makes sense. It totally does. And another thing too is veterans, you need to make sure that you have your packet and all your information that was submitted with your claim because the CMP examiners are not always getting everything that you submitted. So you need to ask them when you go to that CMP exam. So in the future, here's another pro tip. When you go, hey, do you have all the evidence and documentation that I submitted for my claim? Do you have my nexus or my DBQ? Do you see that diagnosis in there? Do you see those medical records? Because a lot of veterans have said no, they don't see that, or the veteran didn't, or the doctor didn't have it. The CMP examiner, they just were looking at, I don't know. They're, 21, 41, 38, and a couple of the medical records that the Raider sent. So it's just important to make sure that all your evidence was considered. If not, you need to take notes because if something comes back jacked up, then you need to have that stuff prepared and you won't know if you don't ask. So be proactive on that.
Exactly. Yeah, that's also a really good point where a lot of veterans will tell me, even after they get a nexus from me and a DBQ, sometimes the VA will still order a CMP exam, right? Which shouldn't happen technically, but it does happen. And they go and they ask the CMP examiner, hey, do you have these notes? Do you have this evaluation? They don't have my stuff. So then the veteran will give it to them and it tends to help. And like I said, there's some really good ones.
Yeah, there
You know,
is.
yeah, there was a former, CP examiner who's a veteran, Army veteran, who's seeing one of the veterans I worked with in the past. And the veteran gave him my evaluation and he said, wow, this is great. And took a lot of information from it. So, and that's really good because that means that he's taken all the information into account and he's open to it. New
Yeah,
information.
exactly. He's open to, and then some veterans have went into mental health appointments or appointments in general, CMP examinations, and they've had the CMP examiner ask them, "Why did you go get an outside medical opinion?"
All right.
And stuff
Yeah.
like that too. So, veterans, you just need to take note of that. And there's nothing wrong. It's within your right. It's one of your, it's a very, very strong right to have in your wheelhouse. And Dr. Prashant is amazing at that, and can look through things for you and all that. His contact information is in the description of this video if you need to reach out. Just make sure that you get the right help, when you do that. But be aware of the potential changes coming in 2025 around the spring time frame, first quarter, April-ish time frame, first to second quarter. Just be aware of that. And veterans, you need to stay up to date. You need to stay educated. You need to tune into Dr. Prashant's channels like mine as well too. And there's other great ones out there, CivDiv, et cetera, that can help you and give you the education that you need. Just stay up to date. There's more information out there than ever before. So thanks for discussing that, Doc. Now, I want to get into any updates. Last time you were on the podcast, we talked about new DBQs and things like that coming out. Any updates on those, brother?
Yeah, not so far. I think it's going to coincide with the April 2025 new rating criteria that comes out. They'll probably release new DBQs as well. I think the one that gets talked about a lot is the area where the examiner has to fill out where he or she got the veteran from as a referral. Did the veteran approach them directly, or were they from another company? These big companies and things like that. And so that's something to keep in mind. I'm not saying it's a big issue, but it's something to keep in mind if you're thinking about going to one of the large companies, that do that kind of work. That basically, that would be part of it. They'd have to put it down there that they got it as a referred from somebody else, basically.
Yeah, make sure that whatever you're doing, that people are fair to you, and that people are upfront, and that people are honest, and that people are integral, and that they're looking at things. If you aren't getting reports back, if you're not, if stuff's not even being asked, certain questions and things like that, you need to be you do need to be careful with that, and always we recommend go to the DAV, go to the VSO, go to your people that can help you. Go and do that. You know what I mean? Even here, if you come and you need some help, then we want to make sure that you get pointed to very good professional, non-blacklisted doctors and psychiatrists and stuff like that are able to do it and are going to take a look and talk to you and evaluate you and make sure that you can be seen and stuff like that, so just take that into consideration,
Absolutely. And, just like in any field, so, there are a lot of great doctors. There are some bad doctors, right? So
Sure.
there are some, who are in the field who might not be giving the best nexus letters, right? Or the best documents to support the claim. So just do your research, look around at reviews, look at YouTube videos, do research as well. Just get your own information, I would say.
Yeah, absolutely. Yep. Do it. It's definitely out there if you want it and you want to dig deep enough to look at that. So, now I want to say with the DBQs too, I have one other question I'd like to talk to you about. You don't foresee them taking them away, do you? Like, there's a lot of fraud and different things like that. So remember, they reintroduced DBQs back in 2021. So they were taken away for a period of time, and then they decided to bring them back. Do you ever foresee something like that maybe happening?
That's a great question. It
I
is.
know that's a tough question, and we don't know. We don't have a magic ball in front of us, but
but I do think it's possible, right? And not to be too negative, but it is possible.
Sure, yeah.
Mainly because of all these audits that have happened that have found fraudulent DBQs, like you're saying, maybe things, assessments that are not full or complete, and things that are just being pushed along, right? And if I think it tips the scale where they're finding that there are too many fraudulent DBQs, or maybe not, maybe inauthentic evaluations, right, and things like that, then it could be taken away. I don't think that's highly likely, but it is a possibility. I think
what
having
would you consider a fraudulent DBQ? What would you consider fraudulent?
Right. So I think that's where they come in and look at patterns, right? So if they come in, now, and they're using a lot of these AI programs now as well in the VA to try to detect fraudulent DBQs, things that are heavily templated, where every single DBQ has the same verbiage in it. And I don't mean verbiage that we require, like at least as likely as not or highly likely, not that type of verbiage. I mean, basically the entire verbiage itself, like the entire conclusion paragraph is the same, except the veteran's name is switched out, or something like that, where they're trying to find patterns where if somebody is just running sort of a, how they used to call it like a pill mill, if somebody's
Nexus mill.
a nexus mill, exactly. And if somebody's doing that, where you can just submit substitute the veteran's name, it's like a fill in the blank almost, and they're generating nexus letters that way. I think that's what they're trying to find in the DBQs, right? And that's the patterns that they're looking for. Another thing I believe that they're looking at is if the ratings are overrated or there are too many symptoms being marked, right? That don't align with what the veteran talks about, basically, during the evaluation. Yeah, so like one example is whenever I take a veteran through an evaluation, I'm not just asking them about the symptoms. I'm asking them for examples, right? So one of the symptoms is, for instance, obsessional rituals, right? Do you repeatedly check things, obsessively check things? Does it take a lot of time out of your day? But give me examples. And then I put those examples in the evaluation so it becomes tangible and vivid and it makes sense, basically. So anyway, that's a long rambling way to say I think that's
good.
Yeah.
Great. In veterans, you need to know that because there's a lot of stuff out there on Facebook and all this other jazz. And, it's okay for somebody to like be on Facebook, but I mean, running targeted ads and different things like that towards you and all that stuff. You need to really be careful of that. And you need to make sure that you are being honest. You need to make sure that, that you're being evaluated properly as well too, so that's very, very important. And listen, these are just things that, could happen. We aren't saying that they will, but we're just saying they could. And these are things that you do need to be aware of. And veterans, you need to continue to get treatment. The way that you're going to get protected and protect your ratings and all that stuff is continue to get the treatment that you need. If it's a problem and it bothers you, then you should be getting seen for it. And you need to continue. It doesn't stop when you just get your rating,
Exactly.
There can always be reevaluations and stuff like that later on for anybody, especially if they suspect fraud and stuff,
Absolutely. Yeah. And it's good to keep talking about these things, right? So if you have a condition that requires follow-up, going in and talking to somebody once a year, twice a year, there's nothing wrong with that. That can only help you. There's no negative with that. And if you're worried that people are going to try to prescribe you medication, don't worry. You can say, listen, I really appreciate your advice. Thank you so much. I don't want to take that medication right now. I'm worried about the side effects, because I think a lot of veterans will tell me, I just don't want to go because they're just going to push medications on me. I understand. But you can still go and then still say, I respectfully decline, the medication.
Yeah. Yeah. And you can also have stuff as needed too, PRN.
True.
You know what I mean? Like, nobody's saying you got to pop everything. They're just saying, hey, try this stuff ain't working out for you. This is an option. And there's cases where medication does help.
Yes.
Absolutely. So veterans, you got to be open and stuff. But if you just flat out refuse and don't go, the only person that you're hurting is you.
Yeah.
You really are, because you aren't going. There's no record. There's no treatment. And again, I'm going to go back to the presumption of sound doctrine that the rater's just going to go, you didn't go complain about it. You don't want to get any sort of help. So you got to be real careful too, even when you are refusing,
Absolutely.
Just how you articulate things. And also another thing is, whatever you do is what you do, but be real careful too, talking about, drug or substances and things like that too, because the wrong rater, wrong person can take that out of context, whether it's medical marijuana or whatever. And they can say, it sounds like you got more of a substance type of issue rather than a, this issue. It sounds like this is the issue, so be careful on that.
Absolutely, absolutely. And I'm so glad you mentioned that on the medication front. I think medications get a bad rap. uh,
Yeah.
I do realize they come with side effects. I'm not trying to push medications on folks, but you're absolutely right. With a lot of folks, it can be life changing with the benefits, and very low side effects. So give it a chance.
There's some people that have to manage through, and I don't know, the fluoxetine is going to help their imbalances and things like that, and it does. It's proven that it will. So there's things that have been created that, can help you and stuff if it does, that, and, you need to outweigh that, or you need to weigh out your options. I should say. So,
Exactly.
well,
Yeah.
well, Doc, I appreciate you, man. I don't know if there's anything that you want to leave any veterans or military members or transitioning service members that'll be tuning into this podcast with, but um, I just appreciate your time, man.
Oh, no, thank you. Thanks for having me. I appreciate your time
Oh,
as
no,
well.
same, yeah.
Uh, yeah, no, I mean, I would say, veterans, keep doing what you're doing. Look out for this information. Get it from Blake's channel
Mm-hmm.
and the other channels that are out there, and
Sure.
keep up to date, just like you were talking about, and keep getting treatment. And remember, you deserve it, right? You deserve to get treatment. You deserve to feel better. You fought for this country, and you deserve these not only treatments but benefits. When it's appropriate, and keep doing what you're doing.
Yeah, absolutely. So, guys, today again we talked about chronic fatigue syndrome, right? And some of the documentation needed, and the elimination process of that, of other conditions to be ruled out, changes taking shape, possible changes in 2025 in the first to second quarter April timeframe for mental health claims. And we talked about updates to DBQs, fraud, and numerous things in this episode. We just hope that you got a lot out of it. We'll be talking more in the future. But if you need a Nexus letter, disability benefits questionnaire, or anything like that, Dr. Prashant, his email is in the description of this video. Just, reach out, let them know, be articulate on what you have, make sure you have the evidence that you need, and just reach out to him. And if he can't do it, he'll point you in the right direction to get the evidence that you need as well too. But yeah, just thank you guys for your service. You matter. Like Doc said, don't give up, keep on fighting, stay in the fight. And Doc, again, I just appreciate your time. Make sure you like, subscribe, comment, hit that notification bell, share this out with someone that could use this information. And we hope that this information of the Off the Battlefield podcast with Dr. Sharma has really, really helped you out significantly. So thank you guys for tuning in. Until next time, we're out. Bye.
Thank you, guys.